Instruct the patient to stabilize against the wall and keep their back leg straight. Slowly drive the forward knee towards the wall while maintaining a straight knee till the stretch is felt in the back of the lower leg, and hold for 30 seconds. The soleus is stretched actively in the same way as the gastroc, the only difference being the knee is bent as the leg drives forward.
For the passive stretch of the gastroc, you're going to have the patient lying down prone with their ankle off the edge of the table. Make sure their ankle is relaxed and slowly push their ankle into dorsiflexion till resistance is felt. We're going to hold this for 30 seconds. For the soleus, move the patient's knee into about 90 degrees of flexion. Have them relax and then dorsiflex their ankle until resistance is met, and then hold this for 30 seconds.
Instruct the patient to stabilize against a wall with the legs staggered, toes facing forward, so that the leg that will be stretched is in the back. Have the patient drive their back knee forward and in till a stretch is felt on the inside of the ankle where the posterior tibialis is located. Hold for 30 seconds.
For the passive stretch of the posterior tibialis, you will stabilize your hand in the middle of the tibia and then push the foot into eversion with dorsiflexion. They should feel a stretch behind the medial malleoli.
The butterfly stretch is an active stretch of the hip adductors. Have the patient sitting down with their feet touching the middle of their body and knees out to the sides. Actively attempt to bring the knees down to the side or use the elbows to intensify the stretch and further push the knees down. This stretch should be felt on the inside of the thigh.
For the passive adductor stretch, have your patient lie flat on their back. You will bend their knee to 90 degrees and externally rotate until they feel a stretch along the medial aspect of their thigh.
Instruct the patient to reach and touch their toes while maintaining as straight knees as possible. The stretch should be felt in the back of the thighs. Hold for 30 seconds while attempting to get further as time passes.
For the passive hamstring stretch, have your patient lay flat on their back. You will raise their legs up until you feel resistance, keeping it as straight as possible. The patient should feel a stretch in their hamstrings or in the back of their knee.
Have the patient face forward and prop their back leg up with the chair. Squat straight down with a neutral spine while leaning slightly back till a stretch is felt in the front of the thigh. Hold for 30 seconds.
For the passive rectus femoris stretch, have your patient laying prone. You will extend the hips slightly and bend their knee until resistance or soft tissue infill occurs. The patient should feel a stretch in the front of the thigh.
Have the patient in a forward lunge position. Instruct them to drive their hips forward and out to the side of the forward leg. The trunk can lean to the opposite side to intensify the stretch in the front hip of the back leg. Hold for 30 seconds.
For the passive iliopsoas stretch, also known as the Thomas stretch or test, you will have your patient lying on their back and tell them to bring one knee as far as to their chest as possible, and hold it. With this knee, you will push through the foot towards the head while pushing the other leg hanging down towards the ground. You should feel a stretch in the groin.
Have the patient lie on their side, aligned straight. Cross the top leg over so the knee points up without rotating the hips forward. Press against the hands to feel a stretch in the bottom side leg and hold for 30 seconds.
For the passive TFL stretch that can also be called the Ober's test, you will have your patient side lying. You will have them face away from you and you will hold their leg while extending and abducting the hip joint. Slowly lower their leg towards the floor and then apply pressure while the thigh is dropping into flexion and internal rotation. You should feel a stretch on the lateral side of the thigh.
Have the patient sitting in 90 degrees of knee flexion and hip flexion and place their foot over their leg, similar to a butterfly stretch. Push the hip down while leaning forward till a stretch is felt in the posterior lateral glute. Hold for 30 seconds. Have the patient laying on their back and have them in a figure 4 position so their knee goes off to the side. The clinician should raise the leg into hip flexion, continuing to push the foot forward towards the head, while maintaining the opposite hip's position so the patient feels a stretch in the posterior lateral glute.
For the active thoracolumbar child's pose is a great stretch. Instruct your patient to sit back on the heels with the knees hip width apart and the palms on the thighs. The torso is then lowered towards the thighs while the arms stretched overhead and the forehead and palms rest on the floor. They should feel a stretch throughout the back and hold for 30 seconds.
Instruct the patient to cross their arms and let their body fall towards their toes. The clinician should then provide overpressure to the lower back so the patient feels a stretch throughout their back. Instruct the patient to fully relax throughout the movement.
For the active quadratus lumborum stretch, instruct your patient to stand upright and then cross one leg over the other. With the legs crossed, have the patient reach up with one hand and side bend away from the hand. You should feel a stretch on the same side as your hand. Hold for 30 seconds.
Have the patient laying on their back and cross one leg over the other. The clinician will pull the bottom leg out to the side under the cross leg. The patient should feel a stretch on the lower back of the bottom leg. Have the patient find a door or a wall with a corner. Have the arm at 90-90 and have the patient press the arm against the wall while stepping forward. Adjust the arm then so that the arm is abducted slightly past 90 degrees. The patient should feel a stretch in the chest and hold for 30 seconds. Have the patient laying on their back with their arm out to the side. Press the patient's arm down towards the floor till they feel a stretch in their chest. Be cautious of the shoulder joint, especially in those with instability. The angle of abduction may need to be adjusted to the portion of the chest that is most tight.
For the active upper trap stretch, instruct the patient to take the arm they want to stretch and sit on it and hold it down. They will take their other hand and pull their head into lateral flexion and hold for 30 seconds. For the passive upper trap stretch, have the patient lay flat on their back. You will hold their head and push it into flexion. Take one hand while stabilizing the head and push down on the shoulder of the trap you want to stretch. For the active levator stretch, you will have your patient position their head in lateral flexion, rotation, and then into forward flexion. With the same side hand, they will pull their head into this position for a better stretch, and they will hold it for 30 seconds. With the passive levator stretch, it's the same motion as the active, but someone else is pushing your head into this position. So the lateral flexion, rotation, and forward flexion is being pushed by the clinician.
Have a seated patient lean their head to the side and look up in the opposite direction. If needed, they can push down on the trap they are looking towards for a greater stretch. Hold for 30 seconds. This will stretch the scalenes and the SCM. As the patient is laying down with their head hanging off the table, position their head into lateral flexion and rotation. You want the patient to be leaning towards one side and looking up in the opposite direction. The pec minor is stretched with a door stretch with the shoulder abducted slightly less than 90 degrees. Have the patient walk into it and push until they feel a stretch in their chest and hold for 30 seconds. The pec minor is passively stretched by pressing down on the patient's coracoid processes. As they're lying supine with a bolster on their back, locate and press down the coracoid processes and push down till they feel a stretch in their chest.